Good morning, everyone. My name's Will. I'm an Assistant Secretary at the Victorian Trades Hall Council, and we are the peak body for the Victorian Trade Union movement. And as such, we're always proud to partner with WorkSafe in the annual HSR Conference. So this year in 2020, we're coming to you from a studio in Melbourne because of the extraordinary circumstances that we find ourselves in, and the aptly named Risks to Psychological Health Conference. I'd like to start by acknowledging the traditional owners of the lands on which we are all variously gathered today. I'm on the lands of the peoples of the Kulin Nation. I pay respect to elders past, present and emerging, and I extend that respect to any First Nations peoples who are with us here today. I acknowledge this land was stolen, never ceded, and that it always was and always will be Aboriginal land. I'll also start with the Victorian Trades Hall Council Statement of Solidarity, which affirms the values that we bring to the work that we do. We are union. We stand united as part of a great movement of workers. Our diversity is our strength, our solidarity is our power. We respect and take care of each other. Prejudice and discrimination, including misogyny, racism, homophobia and all other hatreds have no place in our movement. We rise together. Today and every day we commit ourselves to achieving justice, fairness, equality and dignity for all workers. Solidarity forever. All right, so I'm going to kick off with just a little bit of housekeeping and then I'll give you a brief outline of the day and then I'll hand over to our first speaker. So the first thing is, if you require closed captions, then you should refresh your browser and you should click on CC, I'm told. Also, with the wonders of modern technology, it might be that you drop out at some point. If you do, that's okay, don't panic. Just re-log back in on the same stream and your certificate will be fine. The order of events today is we're going to kick off with some opening remarks. So we've got Collier-Clarke, the Secretary of Trades Hall, we've got Ingrid Stitt, the Minister for Workplace Safety, and we've got Colin Radford, the CEO of WorkSafe. Then I'm going to hand over to our 2019 HSRs of the Year, Sally and Sara. Then I'll be introducing our keynote. So that'll be Dr. Tessa and Professor Maureen, and they're going to talk about psychosocial safety climate framework. So they're going to take us through a framework for assessing psychosocial risk. And then, assuming that there's time, we'll do a bit of a Q&A. And you can drop your questions in at any time as we go. You can't miss it. It's a big box to the right-hand side of your screen, and it says Q&A on it. So if you drop your questions in there, then after we've gone through this morning's sessions, we should have time to answer some questions. And after that, we'll go to lunch. So without further ado, I'm going to introduce our first speaker for today, and that's Collier-Clarke. He's the Secretary of the Victorian Trades Hall Council. Thanks, Luke.
Thank you, Will. Will is correct. I am Collier-Clarke, the Secretary of Trades Hall. Brothers and sisters, I'm very pleased to be with you today. It's a little bit challenging because I'm used to seeing all your beautiful faces in the audience, but we don't have that today. Can I too acknowledge the traditional owners of the land, pay my deep respects to their elders past, present, emerging. This land was stolen, never ceded, always was and always will be Aboriginal land. Now, the funny thing about this conference is this is actually the biggest conference we've ever had, with over 2,000 people who have registered for today. So we're pretty thrilled about that. So congratulations to everyone taking the efforts to be here and to be at such an important conference that talks about the risk to psychological health. An issue that, frankly, we in the movement and we as HSRs need to do more to talk about. Before I get into my main bit of what I want to speak to you all today, we just should note the 60 people that have passed away and were killed at work. This is a terrible number. This number will seem larger than previous years, largely because what we now count is more inclusive of the Victorian community. For previous years, things like people like truck drivers were not included in that because for some reason people didn't regard that their workplace was also on the road, and those numbers fell into the TAC, and we thought that was wrong because we fundamentally think that you count what you care about, and so we're very glad that they've been included, but we are devastated that so many people have been killed at work this year, and we pay our respects and give our solidarity and our thoughts to their friends, family and work colleagues. This has been an extraordinarily strange and tough year. If I can cast your mind back, you would think about the bushfires. And we had those devastating bushfires right at the start of this year. And what came with that was smoke. Smoke that covered everything in Melbourne. And a number of you HSRs came to us and came collectively together and said, actually, what we need in this state is some standards. And so that's what we did. We collectively came out with new smoke standards to make sure that we knew what was appropriate work to be doing in that smoke. So if it's smoky outside and the EPA says it's at high risk or high, we know to stop that work, to cease that work, and to do alternative duties. And that was a super important piece. But who would have thought that would be almost superseded, and it definitely was, by the COVID crisis. That has taken a whole new level of thinking about what our jobs are as HSRs, whether it be PPE, social distancing, making sure that we sanitise our hands. But on top of that, also became the psychological health problems we're seeing by such a long period in which we've had to be locked down. And we understand why we need to be locked down and why we had to go through it, because what we wanted to make sure was that our relatives and our friends didn't get sick by COVID. Because unfortunately, 800 deaths is far too many, and we want to make sure that that didn't get away from us and put such pressure on our health system. I'm going to hear from some fantastic midwives a little bit later who might want to touch on this health system, but it is such a big deal that that you all got together and made sure that these standards were enforced, and you're a big part of the reason why today we have another tally number of zero deaths and zero infections. So congratulations to you all on that work. But it does raise the issue of psychological health. And what we've seen over recent times is the claims to psychological health are going up and up. Last year, we had 3,274 people put in a psychological claim. That has risen to this year to 3,813. The problem we're having with these claims is that nearly half of them are rejected. So 41% of those claims, when they get brought forward to an insurance company, they say to those group of workers who have suffered that they're not legitimate. Now, compare that to a physical risk. So an injury that might have happened on site where you've hurt your back or something like that. Only 10% of those claims get rejected. So just think about those numbers. 40% get rejected if it's got to do with your brain, and 10% get rejected if it's got to do with the rest of your body. Now, clearly there is something wrong in those numbers that we need to address. That insurance companies and others are not taking risk to psychological health seriously. And I'd like to give you an example. I'm going to make up this woman's name. Her name is not Jenny. Jenny is my mother's name, but we'll go with Jenny for the time being. Jenny is an art teacher. She works in a secondary school. She's fantastic at her job. She's one of those teachers that you'll remember for the rest of your lives, or you have that special teacher. She was that teacher for a whole lot of students. She was very competent. She was very hardworking. She was so competent that the school said, actually, you know how you're doing art? We'd actually like you to take on music as well. And, she wanting to keep giving and wanting to work hard and really enjoyed her job, said, yeah, I'll be the music teacher too. And then she was doing such a good job at that, the school came back to her and said, could you also help us run the after-school care program? And she agreed to do that. And then down the road, they said, could you also be something called a head of house, which I understand is a lot of work in a private school system. I never had a head of house. I think it might be something like Hufflepuff or something like that. I don't know. Don't quote me on that, all right? But she agreed to do that extra work as well. And so what has happened is over time, she's become not just an art teacher, she's become an art teacher, a music teacher, doing after-school care, and then doing this head of housework. And it meant that so many of her hours were just dedicated to the job. And she was feeling anxious and more stressed. And she only sort of clicked that it was a huge problem when chunks of her hair started to fall out. And that's when she had that conversation with her OHS reps and the school that they'd put far too much pressure on there. There was something wrong with her systems of work. Because we've got to remember, each employer has a duty, an absolute duty, to provide a safe workplace. And that did not happen for her. And it's not happening for thousands and thousands of Victorians when it comes not just to physical health, but psychological health. And that's why I'm so glad we're concentrating on this today. Brothers and sisters, let me just finish by saying this. You all do a magnificent job, such an important job. Your job has, if employers could add up their productivity dividends, it would be through the roof. But unfortunately, they don't always give you this respect that you deserve, because it can be quite a difficult job, because at times you need to confront your employer to raise OHS issues, which at times might be expensive, might be difficult, and is often challenging for them. We are so appreciative of the work you do. You make our workplaces safer. You undoubtedly save lives and save people from being injured on the job. And so congratulations to your work, and we thank you for that. Enjoy your conference today. And to wrap up, it's now my pleasure to invite the Minister for OHS and WorkSafe to come on. It's Ingrid Stitt. She's our latest Minister. She's just been made up, I think must have been like less than a month ago. So she's a brand new Minister, and we invite her to the conference today. Thank you very much.
Good morning. I'd like to begin by acknowledging the traditional owners of the land on which we're all virtually meeting today and pay my respects to their elders past, present and future. Thank you to the Victorian Trades Hall Council for inviting me to speak today at this important event. I'm really sorry I can't be with you all virtually as it's currently a sitting day in Parliament. But today is a great opportunity to recognise and celebrate the vital role you play as health and safety representatives in our workplaces. You really are the front line of workplace safety, and as proud members of your union, you understand how critical workplace safety is to ensuring that we all come home safe each day. And while the COVID-19 pandemic is certainly shining a light on health and safety in our workplaces, I'm honoured to be able to speak to you all today about another incredibly important issue when it comes to workplace safety, our psychological health. Psychological health can be hard to talk about, and it's not always something you can see, and some of the risks can be hard to spot. As workplace health and safety reps, this can make your job particularly challenging at times. And that's even before we consider COVID-19 and the way it's impacted how we work. And as individuals, we all have different circumstances and different things we are struggling with, including, for many of us, our mental health. Our current situation, although difficult, really highlights the importance of what you are all here to talk about today. As you know, a safe work environment must include consideration of workers' mental health. Psychological hazards in the workplace can be just as damaging as physical ones. And for workers facing mental health challenges, it can be hard to know what to do or where to go for support, which is why the work you do as health and safety reps is so important. And it's also why employers must ensure that mental health support is available to their workers and that they are doing all they can to promote a psychologically safe workplace. I know that helping both employers and workers towards this end is a major focus for WorkSafe. I encourage you all to make use of the excellent resources that WorkSafe has developed around mental health to assist you in your work as health and safety reps. This includes WorkSafe and WorkWell toolkits and WorkWell programs. As a government, we're always looking at what we can do to better support the health and safety of Victorian workers to make sure that WorkSafe has the laws, resources and policies needed so that everyone can come home safe. This includes identifying and responding to workplace issues that impact on workers' psychological health. A key focus for us at the moment is preventing gendered violence and sexual harassment in the workplace. A workplace that is not free from sexual harassment is an unsafe workplace. Victorian employers face serious consequences under the Occupational Health and Safety Act if they fail to provide a safe working environment. And where there is a risk of work-related gendered violence causing physical or mental injury, employers have an obligation under the OHS Act to control that risk. Gendered violence can cause serious psychological injury. What can seem like a harmless comment or a joke can have a very real impact on a person, and it's time we stamped out this behaviour in the workplace for good. Earlier this year, we launched WorkSafe's new guide to preventing gendered violence in the workplace alongside the Victorian Trades Hall Council. That guidance sent an important message to all Victorian employers. Gendered violence is never acceptable, and it is certainly not acceptable at work. We know gendered violence can take many forms, and it's not just sexual harassment, but can include verbal abuse, ostracism, offensive language and innuendo. Of course, gendered violence can occur in any industry or occupation, but we also know that groups such as women, the LGBTIQ community, migrants and people with a disability are more likely to be subjected to it. In Victoria, more than 60% of women have experienced some form of gendered violence at work and have felt at risk in their workplace. This is not acceptable. Workplaces have an obligation to address gendered violence, not turn a blind eye to it. The guidance produced by WorkSafe with Trades Hall provides employers with the tools to identify risks, develop control measures and respond to incidents without causing further harm. It also prompts questions of employers. What measures have you got in place to address the risk of gendered violence occurring in your workplace? What policies and procedures do you have to deal with perpetrators of gendered violence? And do you have a respectful and inclusive culture? As health and safety reps, I'm sure that some of you will be making sure that those questions are asked. But it is on all of us to build a culture that calls out this unacceptable behaviour and gives workers the confidence to speak up. We must ensure that workers are supported to report that behaviour without fear of reprisal and with confidence that it will be dealt with. As well as preventing mental injuries, the government is also committed to ensuring there is support available where they do occur. At the last election, we committed to introducing legislation for provisional payments for mental health claims for every Victorian worker. As many of you would know, last year we launched the provisional payments pilot for our frontline workers suffering from mental injuries. Under this pilot, eligible emergency service workers and volunteers can access payments for medical and like expenses from the moment they lodge a compensation claim, so they don't have to wait to get the help they need. This pilot ensures workers can access urgent medical treatment for their mental health sooner and recognises the importance of early intervention in better health outcomes and enabling a return to work. The provisional payment pilot has been integral to informing broader reforms for the whole Victorian workforce. We look forward to delivering on our election commitments to introduce provisional payments for medical expenses for all Victorian workers who suffer mental health injuries at work. We know it will make a real difference to Victorian workers who need that urgent care. Finally, while I know we are not here to talk about COVID-19 today, I would like to take the opportunity to thank you all for the incredible and selfless work you've done and continue to do throughout this pandemic. Right now, health and safety representatives are on the front line in our fight against this wicked virus in our workplaces. We know the extraordinary efforts you are going to, reviewing COVID-19 risk assessments and taking action where there are hazards present. You should be very proud of what you've been able to achieve in your workplaces. The numbers we are currently seeing are due in no small part to the critical work you are doing to make sure that we're all living and working in a COVID-safe way. The health and safety of Victorian workers will always be a top priority for this government. Already this year, sadly, 58 people have lost their lives at work. That is far too many families grieving for a lost one, and one life lost at work is one too many. We want to see every worker come home safe at the end of each day. I'm extremely grateful for the work that you do, looking out for those you work with and taking action where it's needed. I commend everybody here today. You're clearly committed to making sure you're as well equipped as possible to identify and address risks in our workplaces, and committed as we are to making sure Victorians have a safe and healthy workplace as they deserve. I hope you enjoy the rest of the conference, and I thank you very much for your time.
I'd like to thank the Minister for those words, for those really important words. It's now my great pleasure to introduce some remarks by Colin Radford. He is the CEO of WorkSafe.
Hi everyone, it's great to be with you. I'd like to begin by acknowledging the traditional owners of the lands we're all meeting on and pay my respects to elders past, present and emerging. I'd also like to acknowledge the Minister for Workplace Safety, Ingrid Stitt MP, and our HSRs of the Year, Sara Jorgensen and Sally Collier-Clarke, who I understand you will also hear from shortly. Congratulations to you both. Thank you also to Luke and all of the team at Trades Hall for inviting me to be part of today. Most importantly, I'd like to thank you, the workplace health and safety representatives of Victoria. You are quite literally the eyes and ears on the ground and at the front line of Victorian workplaces. Your efforts, your passion and your commitment to the health, safety and well-being of your colleagues makes Victorian workplaces safer. Thank you for the profound and practical difference you are making in your workplace. Now, we need advocates such as yourselves in every workplace, and we at WorkSafe need to demonstrably support the work that you do. Now, I've been a health and safety rep myself, so I know how hard your role is. But unlike you, I wasn't an HSR during a global pandemic, with all of the additional challenges that brings. The scale, the impact, and the duration of this pandemic permeates through everything we do in every workplace. Now, as some of you may know, October is WorkSafe's annual Health and Safety Month. And just as we are doing today, we've had to adapt and take our program online this year, with a specific focus on helping Victorians navigate through COVID-19 in the workplace. Our program has been built around questions received from the Victorian community, and it's aimed at providing tailored information to assist workplaces with the health and safety challenges they may be facing during the pandemic. Challenges such as working remotely, social isolation, leadership, and supporting injured workers. And perhaps one of our biggest collective challenges, stemming the rise of mental injuries in Victorian workplaces. Now, mental injuries have been on the rise for a number of years, well before this pandemic hit. In fact, in the last financial year alone, more than 14% of all WorkSafe claims were related to a primary mental injury, and this is expected to grow to 33% of new claims over the next 10 years. And whilst these statistics are confronting, the good news is that we are surfacing this issue and we are tackling it head on. When I had my first stint at WorkSafe almost 20 years ago, most people didn't want to talk about mental health. Employers certainly didn't want to know about it. Mental health was a private issue for individuals. In the workplace, especially amongst men, it was a strictly taboo topic. Thankfully, that attitude is slowly shifting. But what can we do to arrest the growth in mental injuries in our workplaces? First, we need to understand the work-related factors that can positively or negatively impact mental health. These can include workload, role clarity, how trauma is managed, how respectful people are to each other, how supported and included people feel, or how just and equitable workplaces are. And all of these factors need to be well managed, because if they're not, they become a risk to a person's mental health. Now, I think we all recognise that workplace mental health is not about resilience or so-called toughness. It's about a culture where every worker is valued, where people are just as important as productivity. As HSRs, you can have an influence. You can make a difference by ensuring employers are consulting with workers, listening to their needs, and taking action where it's needed. And we can provide you with practical support to do this, both directly and through a suite of mental health related guidance and information on our website. We also have our free online WorkWell toolkit that provides step-by-step advice and resources to address each of the work-related factors that may impact on mental health. So far, more than 7,000 businesses have registered, which is a great start. But with your advocacy, we hope to get many, many more. Now, COVID-19 has challenged us all to think differently about how work is designed, how flexible work is, how workloads are managed, how we set up systems to protect people from physical and psychological harm, from violence, from harassment, from aggression, and how respectfully and equitably people are treated. As HSRs, you are critical to our collective success to ensure we reduce harm and can proudly lay claim to having the safest workplaces in the world. For WorkSafe's part, we want to work more closely with you to listen and to find out how we can better support you in your role. As WorkSafe Chief Executive, I get to meet all of our new inspectors on the first day of their training. I'm often asked, what is the one piece of advice I can give? And my answer is always the same. Whenever you visit a workplace, make sure the first person you speak with and the last person you speak with is the HSR. Thank you, and please stay safe.
Thank you, Colin. So now it's my great pleasure to introduce the 2019 HSRs of the Year, Sally Collier-Clarke and Sara Jorgensen. We're going to show a short video and then I'm going to throw to them.
My name is Sally Collier-Clarke. I work at Bendigo Health.
And I'm Sara Jorgensen.
So we are the health and safety reps for the Women's and Children's Services Birth Suite and Postnatal Unit.
We became HSRs because our unit didn't really have that role. So I put myself forward and I also put her forward as well.
Sara and Sally are two of my most senior staff members and the staff really respect them.
So initially there was a change of impact statement that said that we were going to have 7 staff on a night shift.
One night shift, an example, we came on with our 7 night staff. I had to go to an emergency Caesar for twins, leaving Sara there with 4 patients. 1 midwife to 4 is just not appropriate in a birthing suite. It's supposed to be 1 to 1.
There was an increase in sick leave. There was staff threatening to pull out of their positions.
Staff coming to work crying, not ready to start the shifts.
The stress came to people like us because there was lots of call to do extra shifts. The feeling of not keeping your patients safe is very hard to work with.
We put in multiple VIMs. We put in letters, emails. We had a paper load of tracking to be done.
The reason we had to put the pin in was because not only because we needed that extra staff member, our staff were stressed and fatigued.
So a pin is a provisional improvement notice, and we had decided that we had met crisis point. As new HSRs, the stress for us was massive. We're very, very fortunate that our staff got behind us.
They granted us to have that 8th staff member on of a night shift.
It took a lot of energy. It also took a lot of time out of their normal work.
The staff are absolutely amazed that they got what they hoped for. It was never a given we would get our 8 staff. And because we're in such a caring, compassionate environment all the time at work with our women, we're also there for our own staff. And you know, I've had phone calls at home from girls who just needed someone to chat to. And we're always approachable for the girls and they just come to us.
I just really felt was a big sacrifice that they made, and I really felt that they made that sacrifice for everyone.
Sara and I must have preempted things by winning this award last year. Our whole plan was for the stress of our staff to be relieved, and unfortunately we had to go the whole process of doing a PIN, but we proved as HSRs that you can achieve and you can be successful by proving that stress is a tangible, recordable, measurable event. We had been told that we couldn't do it for that stress because you can't monitor, you can't measure stress. That came from our senior staff, our executives, and they just said no go. It took a while to get all that put down on paper and proven. Stress is tangible and it is a impacting event on workforces, and ours being the environment we're in, being midwives, we're supposed to care about our women who come through those doors, but first and foremost we had to care about our staff. Staff in tears, staff taking sick leave. It all impacts on not only the workforce that are there, but on our organisation and on Bendigo Health, in that our sick leave went through the roof.
Yeah, interesting. As Luke just said before, the solidarity is the key. Like, we hadn't had that solidarity amongst our work group, ourselves, and ultimately Bendigo Health, our organisation, and our OHS reps, we wouldn't have got through. We needed that as a backup and to get where we needed to go. So we were very thankful that we had that solidarity.
But for us as HSRs, new out, like we were only 5 or 6 weeks out of our training, which hadn't been a very strong training, to be thrown in amongst all this, the stress on Sarah and I was huge. We at least had each other to fall back on, and we had the ANMF behind us, but ultimately it was us who were answering questions that were above our understanding at that stage, and the impact on our staff who were coming to us in tears and then expecting us to have the answers was huge. And so we think that any new HSRs need to be aware of the fact that this shouldn't fall back onto us. The ultimate answer needs to come from your designated working group, and you know, they're the ones that are supporting us, and it is, you know, a lot of times you worry about how this will affect us. You know, we didn't want our staff to resign, but that's ultimately what could very well have happened. And a midwife to resign from the job they're designed and prepared to work for is really, really sad. And, you know, no matter how long Sarah and I have been midwives for and how much we support one another, you have to have that amongst everyone. And so we created a template that actually showed what was happening on our workforce, what was happening on our day-to-day programs, and you know, we could prove that, well, and lo and behold, there was sick leave again, you know, and staff were putting sick leave in as stress. They were taking it as sick leave because they couldn't be at work. And for midwives, that's really, really sad.
We'd also really employed our staff to use that as their basis for their VIMs as well. We were using that, any little thing that impacted them on a shift-to-shift basis, or even when they got home with their families, we used them to use that as their template really for putting their VIMs in. And yeah, that we were inundated with those, so much so that our managers were saying, please stop, but we were just encouraging them just to keep going. So yeah, it was overwhelming.
And who knew that coming into COVID-19 we would face the same sort of issues again. Our staffing levels are at max at the moment, so they're not even attempting to cut us, which they shouldn't. But the whole impact of not only COVID, of our staffing levels, everything has just been so huge of late that we're fortunate that our levels are where they are at. And we would never have got there had we not started this process when we did it a couple of years ago. But lo and behold, it's Psychosocial this year.
Yep. I think we're probably...
I think we're done.
Yep, we're done, thank you.
Yeah. Got my mask on still. All right, excellent. Thank you. Thank you to both Sally and to Sarah. So we're now going to have our keynote speakers do a presentation for us in relation to the psychosocial safety climate framework. So a framework for dealing with psychosocial risk factors. So I'd like to introduce Professor Maureen Dollard and Dr. Tessa Bailey. They're both from the Centre of Workplace Excellence at the University of South Australia. And they are presenting via live cross to us here today from the university over there. So over to you. I think it'll be Tessa, I think you're up, yeah?
Yes, thank you. Thank you, everyone. Bud and I are delighted to be here talking to you all today and discussing some of our recent experiences in relation to psychosocial risk, psychosocial hazard management, and implementation of the psychosocial safety climate framework. Next slide. So when it comes to psychosocial factors, we're talking about job design, management context, and the social environment that can impact worker health and well-being. And the reason that we're hearing about this more, because as you are probably aware, these factors are increasing not only in Australia, but around most of the world. So what we're seeing is more routine and the less cognitive components of jobs and tasks in your work environment are being taken over by automated processes. And that's resulting in the more cognitive and the less routine tasks taking over in our Australian workplace and environments. So we're seeing these types of job demands, the psychological job demands, increasing over the last 10 years and continue to rise, while seeing resources and supports at the same time are often decreasing. So for best practice psychosocial hazard management to deal with these factors, we need to first of all know what they are and what they're likely to be in our particular workplace. And then we need to measure them as discussed. We need to find a way to capture that level of risk. And then we can design our interventions and strategies to attend to the particular hazards within your work environment and provide some ongoing evaluations to know whether or not the supports are actually able to support and help manage those factors and reduce that impact on worker health and well-being. Next slide. So what I want you to think about today when you're learning and hearing all of this information is that when it comes to psychological health, the first priority and the foremost factor is job demands, because job demands are what impacts directly onto psychological health. Now, that's both psychological and physical demands. When we talk about psychological, in general, we're talking about work pressure. So how hard and fast you're expected to work and whether or not you have enough time to get the job done. We also include emotional demands. And this is like whether or not you're exposed to emotionally challenging situations and if you're frequently required to suppress your genuine emotion. But it does also include physical factors as well. If you're required to sit or stand for extensive periods of time, that's also a demand. And then there's demands in your work environment, whether or not you're exposed to any bullying and harassment, high levels of organisational change, work-life balance, job insecurity, anything that takes your time, energy and effort to attend to are demands in your work environment. But they're not necessarily all bad. They're not necessarily always a hazard. Any bullying and harassment is always a hazard and there should be zero tolerance. But when it comes to job demands, people expect there to be appropriate levels of reasonable demands that appropriately use their skills and resources and supports to match those job demands within their work environment. It's when job demands become excessive or unreasonable or inappropriate behaviours, or if the resources and supports aren't matching. When it comes to resources and supports, we know that the important ones are things like job control, the level of choice you have over getting your work done and utilisation of your skill. Also rewards, not just financial, but respect, recognition and investment in your development. And then other forms of resources and support, such as supervisor support and co-worker support. But we need to make sure that the resources and supports you're being offered are matching job demands. And also I want to remind everybody about recovery. Breaks are important. They exist for a reason during work. So breaks from in between, especially very high demand work tasks, and also recovery outside of your work, that quality of life outside of your workplace. And yes, next slide. So I'm going to be talking to you a lot about psychosocial safety climate, which is a concept that Professor Dollard started developing when she was conducting these psychosocial risk assessments. And she noticed there were particular themes and these overarching concepts that continued to come up that were becoming a very good predictor for these levels of job demands and resources, and whether they were likely to be detrimental to worker health and well-being. And that was the policy, measuring workers' perceptions, their shared perceptions of the policy, practice and procedure to protect psychological health and promote well-being. So that included factors around management commitment, distress prevention, management priority for worker mental health in relation to productivity outcomes. Also the communication that existed throughout the organisation around these factors, and expectations for participation at every level within the organisation to protect worker psychological health. When we measure these factors, we can see this climate can exist at the organisational level, the team level, and the unit level. And when we measure that PSC, we can predict levels of job demands, job resources, and the way that they're going to interact as to whether or not they're going to be detrimental to worker health and also productivity outcomes. Next slide. So when we work with our industry partners, we follow this model. We suggest that you measure this psychosocial safety climate, because measuring this shared perception regarding policies, practices and procedures to protect worker health We can predict the risk. We can predict levels of job demands and resources and whether or not they're likely to impact on worker health in a detrimental way. When you measure levels of job demands and resources, keep in mind they're an outcome of those policies, practices and procedures, but they are also important to predict those the lag indicators, which are telling you about the current status of health in your organisation. Now, they're still important. It's still good to know where where the workers are suffering poor health, where there's injuries, where there's low productivity, where there's high sickness absence. That tells you where there are issues and likely to be issues in the future. But it doesn't tell you which factors in the work environment were contributing to those issues. And it doesn't alert you to negative trends that are likely to occur in the near future. Next slide. So when looking at our data, we know that if we could improve this climate just 10%, we would see a reduction in job demands, reduction in bullying and harassment, increases in job resources and increases in engagement in workplace. We also looked at if we eliminated the highest risk, so low range PSC levels, we would see a significant reduction in job strain and a reduction in symptoms for symptoms of depression within the workers across Australia. And if we were within a different data set, looking at another organisation, if we were going to eliminate low and mid-range PSC, if we could move everyone into a high PSC environment, so very, very low risk, we would see a huge change in levels of sickness absence and presenteeism, where workers report showing up to work, but they're not able to work as hard and fast as they could. They're not being as productive as they could. And we see people using sickness absence and presenteeism as a way of trying to manage these factors in their work environment to protect their health. And when that stops working, that's when we start to see the injury and illness. So looking at some workers' compensation data in South Australia, we could see that the organisations with the highest levels of PSC versus organisations with the lowest levels of PSC had huge differences in their injury rates, in the cost of injury, and in the return to work. So going on to the next slide, what Maureen and I developed was the PSC framework, a way of translating this theory into applied practice. So we have the PSC 12 scale, 12 items, 3 for each of the subscales. You use that to measure your level of PSC, you get a score. We then produce benchmarks so that you know your level of risk based on that score. Are your workers at high risk for job strain and poor health and wellbeing, or are they at low risk? And then we develop the hierarchy of control, because once you get that result, what do you do to attend to it? What do you do to address those hazards? How do you create change? And I'm going to be talking you through that in the next following case study on the next slide. So we worked with Comcare to implement the PSC framework across 11 units from 8 organisations, both representative public and the sector. We measured their PSC in both experimental and control groups. So we had the experimental groups participate in workshops with us, but we also measured PSC in control groups, so a similar unit conducting similar work within that same organisation that we didn't implement any kind of workshop based on their results. So we measure PSC, we get good response rates because it's quite an objective measure, and people seem to understand the items and what we're trying to measure and observe by asking these questions. And then we had particular people attend the workshop. We invited specific people because our data shows that there are key influences in transmitting this climate throughout an organisation. So we decided to target them to try to create change. So that was having someone of a general manager or executive level and someone of an occupational health and safety or HR representative, and someone of a more supervisor level who's more on the ground and understands the particular factors happening in their work group. And we also recommend having a union and or HSR representative at these workshops. So during the workshop, we give psychoeducation. We talk about the common psychological demands that exist across organisations, across occupations, and we talk about the resources and supports that are important to match to those job demands and how they can interact, impact worker health. I then presented them with the results of their PSC risk assessment. We helped them to develop action plans, which I'll be going through with you in a minute. We then provided some ongoing support for the first month to finalise action plans. And we invited representatives to attend monthly meetings so they could give feedback on how their action plan implementation was going, and they could share resources and supports, address barriers and facilitators. Then we did another PSC risk assessment and process evaluation at the 6 months and 9 months after the first psychosocial risk assessment. So this is what, next slide, this is what the PSC 12 looks like. Here are the 12 items. 3 items for each of those 4 constructs, those 4 subsystems, as a way of evaluating the quality of your occupational health and systems to protect worker health and to promote well-being. Next slide. So we implemented the risk assessment. I then broke it down based on those risk ranges. So I could tell organisations the distribution of risk within their particular work group and work units. And we also gave a comparison just to the overall national risk levels. So you could see, is this similar to what's happening around Australia? And because we're lucky enough to have access to excellent data, I can also give this information based on a state or industry level. So you know if your risk is a bit more relative to those kind of external factors or unique to your group or organisation. Next slide. And then we break this information down into the subscales. So that way I can tell you what things you're doing well within your systems to protect worker psychological health and where you need to target to create change and reduce that risk and improve that climate. Sorry, next slide. So that's the subscales. So that tells you which of those subsystems you are likely doing well. Is the communication good, but the management priority low? Is the management commitment good, but the participation low? So then you can start working out where the strengths and weaknesses are within your organisation. Next slide. We also break it down by item, because that way you can really target the specific items within each of those subscales when you're trying to develop action plans and strategies. You want to attend to your lowest scoring items to target and create change to reduce that risk, improve that climate. Next slide. So bringing it back to the best practice, you're going to be learning about how you identify these particular factors that are likely to exist in your organisations, in your work units, in your work groups. Find ways to measure them. There are a lot of tools and resources out there. I know there are some excellent ones that are going to be presented to you today. When we observe it and measure it, then everybody can come together with a shared understanding for how to attend to it. And then you're designing your interventions based on that evidence. And this is where I think what I'll be talking to you next could be really useful, because this is where I got stuck in practice. You did an assessment, you got a result, you even knew the level of risk, but what did you do to attend to it? So you get those key people together, you design the intervention, you implement these strategies, and then you evaluate to see whether or not they've been effective in reducing risk and improving that climate. So next slide. We developed the psychosocial safety climate hierarchy of control as a way of improving your systems within your organisation to create that protection, to promote proactive action in preventing these hazards rather than attending to them after they occur. So this is where we suggest for any factors that you see as a hazard in your workplace, go through this hierarchy to do a bit of an audit for what you're already doing. It will help you find the gaps to develop strategies for what to do to attend to it. Because what you want to see is right from the top, policy and practice that attends to worker psychological health and to the particular job demands that are likely to be hazard in your work. We then want to see this being implemented through policy, practice and procedure throughout organisations, through your human resource management and your OHS systems. We want to see it demonstrated, enacted, role modelled by your leadership group and by those middle managers. We want to know how it's likely to be impacting job design. How is it directly impacting levels of demands to ensure they are reasonable, to ensure they are not excessive, to assure appropriate workplace behaviour, and to assure that the resources and supports are matching those job demands? And then what is the worker expected to do to participate appropriately in these systems? We include the subscales in the hierarchy because when people say, well, what particular actions am I supposed to do? Should I be telling people to do? Well, where do you see management demonstrating their priority? High up in the policy. How are they demonstrating that in the policy? How is that then shared through management commitment at that leadership level? So how are the leaders all demonstrating that commitment to protecting psychological health? What actions are what actions are existing? What could you be doing? How is it being communicated both down through the policy, practice and procedure, and what systems of feedback is there to give information back up through the organisation? And what is the expectation of participation at each one of those levels? There should be example actions of participation at each level to protect worker psychological health. Next slide. So this is an example action plan that we developed. It's possible that you have your own, it's possible you have similar ones, and if you can align things to your own existing systems, it's more likely to be successful. Or you can use this action plan that we designed. So what we suggest first is you identify the hazards that are likely to exist in your workplace. As I've been talking about, where are we likely to see the excessive job demands? Are there inappropriate reports of inappropriate workplace behaviour? And or attend to those subscales for PSC. Is it more likely to do with management commitment, or is it more likely to do with communication in your organisation, or just address PSC psychological health in general? But we also want you to have done some kind of measurement so that you can give a level of risk, because we want to see that risk change over time. So when you use these objective measures like PSC, we can have a specific level of risk. And a lot of the other tools out there measuring these psychosocial hazards and job demands will also give you some kind of risk indicator. Then we want you to put down, you've done your hierarchy of control, what currently exists in your organisation to attend to these factors. So what are you already doing to try to support, ensure reasonable demands? And then what could you be doing? Where were your gaps when you went through the hierarchy? Could you not come up with an example for how it's demonstrated through management commitment? Is it not clear when workers are meant to raise these issues? Are they being attended to during regular workforce health and safety or OHS meetings? And allocate some resources. Often it's time, sometimes it's money. And who's responsible? As well as give yourself some timeframes for achieving these goals. Reasonable, realistic timeframes that are not excessive. We don't want additional demands for achieving these goals. When we worked with our participants, we saw that they really listened to the information we provide. Next slide. Sorry. So with the action plans, we saw themes in relation to ensuring reasonable demands. That was sometimes creating new policy about overtime. Sometimes it was clarifying current policy about work roles, service delivery, expectations, KPIs. And then we saw systems for communicating that policy and practice within those units and divisions. And we saw leaders demonstrating, actively supporting, very transparently openly telling workers how they would like to participate in those systems. We saw formal systems for reporting psychosocial hazards as they were arising. We also saw psychosocial safety coming up on meetings and at agendas or being attended to in other procedures. We could see that these key people were thinking about the particular resources and supports that exist to match the biggest hazards, the greatest demands, and whether or not additional resources and supports were needed, or whether the focus of those resources and supports could be utilised in a different way to really protect psychological health and promote wellbeing, to think about the appropriate forms of reward and recognition, and not to forget about recovery, to remind workers to take their breaks, to get up, to move around, to get outside for some fresh air, and also when you finish your workday to switch off. There shouldn't be emails and texts outside of work hours because we want workers to have a quality of work-life balance so that they can be energised to go back to work for their next shift on the next day. Next slide. And success. We saw the majority of our experimental groups were able to significantly increase their PSC over time throughout the program, and they were able to therefore effectively reduce the risk to worker health and wellbeing. And the next slide shows a bit more detail of those results. So we saw both our experimental and our control groups started off at around the same level of PSC. And then following the workshop, 4 months later, and where we supported the action plan development, where we supported action plan implementation, we saw PSC significantly increase, which means a reduction of risk over time, in particular for that experimental group, whereas the control group remained relatively consistent. And then we see wave 3. And hang on, I need a drink before I explain what happened at wave 3. Wave 3, we were collecting data in March. We sent out the surveys. We started sending out surveys in March this year. And as I was sending out the surveys, we saw a particular pandemic starting to emerge, and then really start to influence and change the workplaces that we were working with. So at wave 3, we did continue to collect data. Some of the organisations were a bit unsure about collecting the data. Some of them delayed the data, but we decided it was important to collect this information. People would want to know what was happening in their workplaces at that time. So we continued to collect the PSC data. And it was really good that we saw the PSC increase for our experimental groups. It continued to increase. We do think it's entirely possible it would have been a greater increase had the pandemic not hit in the way it did. And it was very bizarre because for our control group, we saw an increase as well. And when we broke it down and looked at the groups, we could see that those that had a previously low PSC, when they could see their managers and their organisation attending to the most immediate hazard, attending to those immediate demands, putting in place procedures to address that, the PSC increased. So it showed that when the organisation and the management context and the job design gets together, you can increase that PSC, you can reduce the risk. Whether or not that remained consistent over time, we would have to do another data collection to analyse that. But when it came to the process evaluation, next slide, we could see that 100% of the workshop participants agreed that this information was useful for building their systems, their capability and their OHS systems capacity for managing psychosocial factors in the workplace. People said that it just increased their knowledge from even 0 to having a good understanding about these particular factors and how they can be a hazard. We saw that 50% had implemented some or most of their actions within the first 6 months with their ongoing resources and supports, and that we saw 90% had implemented some or most of their actions after 9 months of implementing that program. And also in the process evaluation, next slide, we saw 90% agreed that having that mentoring and support, so we had Comcare organising these once a month meetings. We had at least one representative attending to give feedback about how they were implementing their actions. We helped them address any barriers, and we helped support them to keep refining those action plans and implementing them. And that was an extra resource and support because to participate was a bit of an extra demand. And we also had 90% agree that the program was useful for their capacity to manage psychosocial factors in the workplace. Next slide. When it came to facilitators, the things that really helped was this genuine recognition of psychosocial factors and consistent support from the leaders to address psychosocial barriers, not surprisingly, financial constraints, competing demands, and lack of senior management support were significant barriers when trying to implement action plans. Some of the comments that I just wanted to highlight, our workshop participants advised that it helped them understand where they were and weren't attending to these factors appropriately within their work environments. It helped them to feel confident in having this shared language and understanding, to talk about it, to raise these issues and to find where it could be addressed within their current systems. And then it became a part of attending to their workplace factors, their day-to-day, just a part of hardwiring within discussions in relation to worker health and safety. Psychosocial factors became part of that. Next slide. And so that's the example comments about how it became part of those systems, part of the hardwiring. People felt comfortable, confident, they understood the language better, they could create that within their organisations. And next slide. Because of COVID emerging during our final data collection, we decided to add questions about COVID and take advantage of that situation. And what we found was 90% of participants said that it had impacted factors in their workplace. That's not surprising. I was expecting 100%. So what we saw was people reporting increases in job demands, a lot of change in workplace practices, and things like being required to work from home. But the good news was that the majority of our participants said that the program helped them to manage and attend to those factors during the pandemic and as these changes were happening. Next slide. So examples about how that was happening was attending to these changes in workplace practices, thinking about how you can use leave to immediately provide a resource and support for those demands, attending to the IT. Then there were issues with lack of clarity, communication about things being delivered. That was difficult to work through, people feeling disconnected and isolated while working from home. Next slide. So we asked people about the good practices they saw to attend to these, the impact of these factors, addressing these issues as they arise. And they saw that there was just a bit more general discussion, talk, willingness to raise these issues, identify the factors. When you were talking about physical to the work environment, there was also discussion of the psychological impact of changes in the work environment. And then there was a more proactive discussion from management, from leaders, saying about how they want you to attend and protect your psychological health, and attending to these communications, which became both formal, informal, online, offline, but the discussion about psychosocial factors became part of those communication systems. And then, next slide, we come back to ongoing evaluation. So you've thought about the factors in your work environment. You've found some tools that are going to help you to address, assess these factors, measure them in an observable, objective way, determine a level of risk. You then design your action plan, potentially using the hierarchy of control, PSC action plan. Think about those PSC factors. Designed your action plan. You've started implementing it. Set your resources. You've given yourself a time frame. And then to do ongoing evaluation, you assess again. Use the same tool. Use PSC if you want to, because we see that's one of the first things that'll change. That risk will change in your work environment. Then we'll see changes in job demands and resources. Those lag outcomes can take a year to 2 to 3 to 4 to 5 years to show significant change. So a more regular ongoing evaluation will tell you, have your strategies, the resources and supports, attention to job demands been successful in reducing risk and improving the climate for protecting worker health in your organisation. So getting towards the end, I want you guys to think about how you can capacity build the systems within your organisation to attend to these psychosocial factors, how you can build your own capability through training and or whether or not other training is needed. We encourage these observable, objective measures to identify factors and to assess a level, an element of risk. And use that as an evidence base when you're creating strategies for that intervention design. Collaborate with your employers and industry partners, because any resources and supports that exist that can help you, you want to utilise, and then conduct ongoing evaluation. So you know whether or not the things you're doing have been effective to reduce risk and better protect worker health and better promote wellbeing. So in conclusion, each organisation and each work group is going to be unique in the hazards that exist. So some exist within the team and the unit, some exist across the organisation. Include measures that have that protective, that promote reasonable demands. So things like psychosocial safety climate. Consider where external consultation may be necessary, especially in initial stages of development and setup. And then you may find that you can capacity build within your organisation to do the more internal regular basis, or whether or not you work with an external body on a regular basis for psychosocial risk assessment and data and continuing that ongoing evaluation. What can you do within the organisation? What do you need external resources and supports to achieve? And hopefully, if you start attending to these things, you're going to see a wide range of benefits, more protective systems, promoting reasonable demands, ensuring worker health, ensuring appropriate behaviour, better safety outcomes, reductions in turnover, reductions in sickness absence, and a reputation for being an organisation that promotes worker wellbeing. I'm finishing there. I'm just going to give Maureen a minute or two opportunity to add any comments to this discussion. Thank you.
Great. Great, thanks very much, Tessa. That was a very thorough presentation and outlining the importance for assessing risk using an evidence-based approach. There's a lot of science behind this, so we're finding employers all around Australia taking notice. In 2001, I participated in a symposium convened in Canberra about work stress, and the Australian Chamber of Commerce was a visitor there and stormed out of the meeting saying that work stress was a myth. I think we've come a little bit further since then, but I'm also distressed to hear from Luke that, you know, still a lot of workers' compensation claims for mental health problems are being rejected. One thing about the psychosocial safety climate that is good for unions is there is an item in there which says, you know, is there participation and consultation with employees and employee representatives about work health and safety issues as they relate to psychological health? So there is a kind of a protection in there. If you guys are not being consulted, if workers are not being consulted about these issues, you can see that the actual psychosocial safety climate is going to be less. And we've seen, we've done some research across Europe, which shows that in any countries that have lower levels of union density, that psychosocial safety climate within organisations on average is much lower. So, you know, we can see that there is a strong role for employees and their representatives to try and, you know, work for a better situation for workers in Australia. Thank you.
Am I back? I'm back. Am I back? Yep. All right. So thank you very much, Maureen, and thank you, Tessa. So now we're going to do some questions, and we've had some come through. I'm going to open with a question which goes to really all four of you, and I'm just going to paraphrase slightly. But the question is, there is stigma attached to mental health issues such as stress and distress in the workplace. What do you think an employer can do to reassure people that it's not going to result in limiting career prospects or other issues that might happen at work? I might kick off with one of you, Maureen and Tessa, whether you've got a view about that, and then I might come to the two of you.
Can I?
Yep,
Sure.
go for it,
Yeah,
Maureen.
you go, Maureen.
Yeah. Well, what was really interesting, what Tessa showed in the second part of that intervention study, when COVID was coming, that when it seems like across Australia, it was okay to talk about mental health for the first time in such a big way, because there was an external cause, and we've already heard that, you know, when it's a physical injury, that workers' compensation is much easier to manage. So when there's a identifiable threat, we can see that workers' compensation is easier. So it's about the stigma, and I think we're getting a lot of feedback here. Yeah. So I think that the more that people are talking about mental health, the more that the stigma will be reduced over time. But we need to have confidential feedback systems within organisations on a routine basis so that people can talk about psychosocial risks.
Did you want to add anything to that, Tessa?
I will. I'll add that I think the employer has a responsibility to ensure there's language systems in place so that people know when to raise these issues appropriately as they arise. Having this common language, having your workers know what are the words, how do I express my distress due to the workplace environment, due to workplace factors, in a way that isn't necessarily about personal, my manager, this is happening. If we've got saying my job demands are high, it's this particular workload, it's this factor, and then we've got these ways of measuring it in an objective way, we can all come together to have a look at those results, that data. It takes away the personal opinion and makes it about workplace factors. and puts things down on paper so that people can come to a shared understanding across the organisation about how to handle it and how to manage it in a proactive and appropriate ways.
Cool. Did either of you want to add anything to that?
I guess knowing that you've got that support as well, like knowing that you've got those people to go to speak to as well that are able to support you or even guide you into that next step where you need to go, that's really important.
And Bendigo Health does offer a psychology talking group that can discuss our stress levels. So I think we've got a good support network happening, and with our mentoring program, so as Sarah says, we've got always someone else we can speak with.
Great. All right, so the next question I've got is that psychosocial issues, for instance, let's say that it's an issue of you're experiencing stress or distress because of a poor manager. Those kinds of issues are only ever talked about, for instance, with OHS committees in very broad terms because of this issue of privacy and confidentiality. So how can we put things in place that mean that issues like that can be resolved if they're only ever talked about in general terms when they make their way up through the kind of systems in the workplace? Does anyone have any thoughts about that?
So for us, we have ourselves as the HSR reps, then we have our DWG, and for us, our DWG is our whole unit. So we have always someone to talk to. We then bring it to our attention, and from there we would act on it. If someone was truly having issues with their managers, that's a concern. And I'm actually at the manager's level, it would distress me if someone at my level was causing these issues, so therefore I would actually take them to them personally. Yeah, it's not acceptable at any level.
Did either of Maureen or Tessa, did you want to add anything to that?
I would add that the leaders having those shared perceptions and understanding that responsibility for how they want to manage their workers, ensure reasonable demands, so that there is a shared understanding amongst the leaders. If you have objective measures, that might show you where some of those issues could be arising, and whether or not you need to have some external systems for collecting that data if that suits your organisation, so people feel more comfortable in reporting it. But there needs to be those systems. Workers need to know how to access it. And if it is, I feel confident in going to a champion, a HSR, and that I feel confident that they know how to manage that appropriately, that would be a great system to attend to that issue as it arises.
I've got another question, which is, it's a little bit different, but it's specifically around how we manage things like sexual harassment or gendered violence in the workplace in situations where if that gets raised, then the response is that it's just joking. I was just joking, right? It's just a joke. I'm wondering whether anyone has any thoughts that they can give to this HSR around what they would do to escalate that and have it resolved.
So we have a zero tolerance for anything like that in our workforce, and should there be any issues of sexual harassment, we take it straight to our managers. It's actually not acceptable at any level whatsoever. And I think that if you are facing those issues, then I would, as the HSR, get some actual documented evidence of that and take it to your managers. Stop it right at the core of it.
Yep.
Yeah, definitely.
Maureen or Tessa?
Yeah, I mean, we have various kind of tools that can be used to assess levels of harassment and bullying and so on in the workplace that can be compared against other workplaces. So this is another way to raise the level of concern about some risk factors by making comparisons with other workplaces. You know, we're just actually looking at a place right now which, you know, shows some pretty bad statistics, and it's pretty hard for a manager now armed with this evidence to actually do nothing. I think there's a lot of, actually a legal imperative to do something at this point.
Yeah. Can I add?
Yes.
Often when I see this high risk, I must say I often see high levels of bullying and harassment in the environments with high risk. Lots of factors contribute to that. You could probably do a whole day on bullying and harassment, but I know that when we see high risk, we often see these results of high bullying and harassment. There's history and there's culture behind why we see high levels of bullying in Australia, and we do. We've compared it around the world. It is high in Australia. I absolutely agree with the zero tolerance. I think it needs to be proactive. It's really good if you've got an external or some kind of measure so you know where those hotspots potentially are, but we need it to be from the leaders at above. What is considered appropriate workplace behaviour? Clear, demonstrated actions, communications, examples throughout induction, recruitment, ongoing training, leadership management about appropriate language, appropriate humour, inappropriate language, inappropriate humour, because I totally agree with Lawrence. Also addressing these issues as they arise in a quick and respectful manner. So where is the system for that? It doesn't have to be a specific, it can be unique to each workplace, but again, your people need to feel confident to stand up for themselves in the first instance. If that doesn't work, to find a support system within that organisation, and to know that if it does become a major issue affecting their health, that they can actually raise that in an appropriate way within their workplace.
I know we too use a system of red flags as well amongst our unit especially. I'm not sure across the whole hospital, but yeah, so we put that on our workers as well, so that if they are in a discussion or something that's happening, they feel that that's not appropriate talk, we put that back onto them, and they're to say that that's a red flag, that's so yeah, to people just to stop that discussion there and then. So it seems to work well.
So I've got a question here. Can you explain presenteeism and give advice about how you could talk about that with your employer? And Maureen, I see you smiling, so I'm going to go to you first.
Well, we were just laughing about that yesterday, about how, the definitions of it are quite strange. But I mean, presenteeism for me is turning up to work sick. I mean, just don't come. I don't want people coming to work that are unwell. And I mean, it's easy to say that. I understand that, COVID showed this, that people from, lower socioeconomic situations are going to be most vulnerable to that. They might not have the resources and their jobs might be at risk if they don't turn up. But in general, we've got to think of ways of being able to communicate that it's really not okay to come to work if you're unwell. I think maybe through COVID, we can figure out ways of contributing by actually being at home. What it means for me is being at work, being unwell, and not being able to be as productive as you might be if you were well, something like that.
Does anyone have any suggestions about how you might raise it? Go, Tessa.
Well, yeah, when we measure presenteeism, we literally just ask workers, how hard and fast are you working compared to how hard and fast you could be working? So you might not be working at your optimum level because you're unwell. We find that people are trying to protect their energy, their effort, their stress, and then they're not being as productive. Or they're under so much pressure that the quality of their work is being affected. They can't do it properly, or the systems are preventing them to, so then they are less productive. It's about motivation. It's about the resources and supports ensuring that you can be at your best level of productivity. So there's different ways of defining presenteeism, but it does try to capture whether or not you're working at your best level, engaging in that work environment in a productive way. So how you raise that directly with your manager, I suggest all tasks, everything should be about the tasks you're doing, about the work you're doing. Is it to do with the job demands? Are they so unreasonable that you're overwhelmed, you can't actually get them done? Is it because what Maureen said, you're feeling unwell and you're still coming in and you're not and you're running yourself down and you're exhausted, and that's why you're not being as productive as you could be? Is it because the resources and supports are not matching the job demands that you're trying to achieve, and that's why you're not being as productive? So that's why I like people to learn about those particular factors, so that if you're going to raise issues about productivity and presenteeism, you're also thinking about the factors contributing to that, because it is an outcome of your work environment.
Do you have any of that at your workplace?
So along the lines of the stress side of stuff, we actually had to look really hard at whether people were coming to work and being present at work, even though they had the stress levels. So then we had to sort of say, are you actually an effective part of our team today? Or would you be better off at home trying to work out what's going on before you come back to us? We need to be actually able to all work at the best of our level in our job. We don't have the ability to, say, call in extra staff at the drop of a hat or whatever, you know. So if you're not at your peak, be that for stress, be that for physical sickness or whatever, maybe you actually need to have a look at stuff and see that you're going to be present when you're at work and then present when you go home. Because we all want to go home. We don't want to take our work home with us. We don't want to be stressed when we get home and bite everyone's head off. So present at work or present at home. Yeah.
Yeah, we actually can't afford people to, especially, well, physical sickness, can't afford people to come to work being sick because, yeah, it just puts everybody else at risk. So I think we're pretty lucky in that respect. We don't have a lot of that happening, but yeah, probably more the stressor side of things. That was where we were finding that there was an issue. But yeah, people soon realised that when we started all this whole process that they didn't have to do that anymore. So and we were supporting that.
So you work in a very particular environment where probably the notion of showing up to work when you're not well has particular risks, right? For your
absolutely.
Yeah. So I've got a question. It may not arise in your workplace, therefore, which is how do you progress that conversation about, how do you initiate a conversation about mental health issues in a workplace where they're not of a mind to see mental health issues as a workplace risk? Like in your workplace, it's very clear, right, that you cannot be working, supporting other people, looking after patients in circumstances where you're not there, you're not 100% there as you've described it. I suppose the question that's been asked, and I'll put this to Maureen and Tessa, let's say that you're working not in a health environment, but in a very different environment where they don't come to it with that kind of frame. How might you even begin to have a conversation that says mental health issues are a risk in the same way that using the machinery is a risk or whatever? How do you begin that conversation?
I mean, it depends who you're having the conversation with. But if you were really having issues in relation to work stress, I think taking a friend to a meeting with the boss is a good idea. So, a support person. It could be your partner. I think if you bring your partner along to that sort of meeting to say how things are at home as a result of what's going on can be quite powerful. And you have to think that sometimes a manager will be responsive, and sometimes they might not. And and then they're a complete arse, right? So then you have to think, well, is this the kind of workplace that I want to be in? I mean, it's a toxic work environment if you can't talk about mental health in 2020. I mean, seriously, everyone is talking about it at the moment. If you can't raise the issue, there are serious problems with the organisation. And so I think, the unions have a role to try and assist with the education and the support of workers to raise this issue and have it on the agenda every time you can. And I've been really impressed today with, everyone's talking about psychosocial risks. We didn't even talk about things like that in the last 2 decades, So we're making progress, we're getting there. But it's still some ways to go.
Yeah, I wanted to mention that Maureen and I have been working hard on putting costs against the outcomes, the poor health, the poor work, the poor injury, the productivity, the turnover, because we found that's a really good way of connecting with the employer. We do find that it tends to be the more progressive organisations who come to us, but that is shifting, that is changing. I don't think employers can deny that psychosocial factors do exist and are increasingly existing within our workplaces, but we are currently working with HSRs in workshops and with union representatives to develop material to support them, to enter into their own organisations, to address these issues, to raise these issues. As the education improves, as the language improves, as we have objective measures, so it becomes less personal, less intuitive. We're seeing more attending to these issues within the workplaces, and we're seeing that change happen.
And I will say to everybody who's with us here today, the slides from the presentation that was done for us earlier by Tessa and Maureen, they'll be available on the VTHC ohsrep.org.au site, and that will probably have some handy information for you in terms of some of the structures that you can bring to raising these issues, because it sounds, if I'm right in saying, the kind of summary of what we're hearing so far is it's about systems and structures as well as raising an individual issue, right? So an individual issue can be a manifestation of something that is broader, and one of the ways that you can take out some of the heat from it is to do it in a more systemic way and kind of approach it with that kind of bigger picture type thing. I have here it's a question around, I suppose, and I don't know whether we'll have an answer, but we're going to have a crack at it. Some workplaces, they're very big, and the HSR has a designated work group of 80 or 100 people, and they have to try and raise issues or represent in that way, and they have to raise them. And sometimes the issues are about how management does things. So I'm going to ask our HSRs of the Year if you can give some advice to someone who's clearly feeling a little overwhelmed by the job and feeling like whether you've got any bits of advice for an HSR about raising issues in that kind of situation.
So we're from a unit of about 110, 120 midwives.
Yep.
So my advice to you is get a buddy. You can't do it on your own. There's no way known. Saz and I, thanks to Sara, joined together, and so we've got us as HSRs. Then you've got to get your DWG, like make your working group there. We did that. We asked for initially 5 to 10 people, and we got 100. So if you're going to bring things up to management, bring as many along as you can. And so we took everyone with us when we went. And I think you just need a buddy and help. Full stop.
Yeah, I agree. You can't do it on your own for sure. And Sally was very happy that I brought her along for the ride. We're always trying to bring other people on board as well. It's not been overly successful yet, but we're still trying. But yeah, we're getting there, and we have got a good support base as well. So we're pretty lucky where we are, but you definitely need it.
And Maureen and Tessa, did you have anything you wanted to add to that?
I see in the bigger when it comes to the larger organisations, there's a longer distance between the worker and the expectations for policy, practice, procedure from the higher level. So the bigger the difference because of the size of the organisation, the clearer the systems need to be implemented. You might have executives at the top that are relatively well-intentioned, but if that's not filtering down through the communications, through the systems, through the practice, through the middle managers, through the leaders, then the worker isn't going to perceive it, and it's the worker's perception that predicts those outcomes. So the bigger the organisation, the clearer those systems and structures have to be, the opportunities for when to raise these issues. Absolutely a working group. Like I said, we see key people within the work environment, especially in those large organisations. So yes, your health and safety and your union reps working together, find a workforce health and safety person. Likely there's one who has knowledge and experience or some expertise, and if not, there should be, and they should get training. There is a legal obligation here. You can come back to the law about protecting worker harm. Part of that is knowing about the current hazards that are likely to be existing in your workplace. And as I said, the wage and now, most people are in the kind of occupations where these are the types of hazards that are being the greatest risk to their health, especially their mental health. And there is an expectation under law that you are aware of it, that you have appropriate resources and supports to attend to it, to measure it. You've got the right trained people, the right staff, the right skills, the right experience in the right positions to do something about it, especially when you have a large organisation and you're responsible for so many people.
All right, I think we will wind up the questions then. I want to thank all of our presenters from this morning, Maureen, Thank you very much for that, Tessa. As I said, we will have the presentation that was done earlier. We'll have that available on the website. Just to remind you all again, that's ohsrep.org.au. So we'll load that up. And I particularly want to congratulate and thank our two 2019 HSRs of the Year, Sara and Sally, for the amazing work that they've done. And I just, awesome work. Just awesome.
Thanks for having us.
From here, we're going to have a lunch break now. I'm asked to remind you all that you need to be back here at 12:45 for this afternoon's session. And that wraps up this morning's session.
Thank you very much.
Thank you.
Thanks, everyone.
Good afternoon, everyone. I hope everyone had a lovely lunch break. My name is Dominic. I'm the lead organiser of the OHS team at Trades Hall, and with me, suitable distance away, is Renata as well. We hope that everybody was able to log on. I know it's been a bit of a scrambled morning for some of you there, and well done. Special mention to everyone that managed to download Google Chrome at the last minute. So it's been an interesting morning so far. We've heard from the HSRs of 2019. It's been great, I think, that their issues involved psychosocial hazards in the workplace. We also heard from Maureen and Tessa as well, and they've done some really interesting work. I think their work does rely on management support and sometimes even the executive support as well. And we all know that that can sometimes be a bit challenging. Some employers, when they really want to do something about psychosocial risk factors in the workplace, and they just don't know exactly what to do. It's still very new for some people. Some employers don't want a bar of it, and there is another group of employers who say, that sounds like a great idea. Wait a second, that affects productivity. Maybe we should do something different as well. It is a challenge to raise psychological issues or psychosocial issues in the workplace. Very often they're invisible. They're more difficult to identify, and sometimes they're just treated as inherent parts of the job as well. We've heard some great examples of that today. We've talked a bit about fatigue. We heard about the stress in the maternity ward at Bendigo Hospital. We've heard a bit about the effect of workplace culture, occupational and gendered violence. And look, I think it's pretty clear, I believe Colin as well said this, resilience is not a control. Just saying you need to toughen up, that's not good enough. It's not about the individual, it's about the workplace and controlling those factors in the workplace. We've also heard that psychological issues, psychosocial hazards in the workplace are a big and a growing problem. They are a health and safety issue, and we need to get better at applying OHS frameworks that we can understand, and we do understand in the world of physical hazards. We need to get better at applying them to psychosocial hazards. So we look at something, we can probably be a bit glib and say a trip hazard is pretty easy to identify, but there are other issues which are a bit more difficult or more invisible. Noise issues, airborne contaminants, for example. They're big issues, but they need research, planning, and a step-by-step approach to trying to get a resolution. You just can't go in there as soon as you've said, this could be a potential problem. You need to have a think about how you're going to deal with it. One final thing I did want to say is, before I hand over to Renata, is that I think jurisdictions around Australia and indeed around the world are getting better at identifying psychosocial hazards. In December 2018, Marie Boland handed down a report, a review into the model WHS laws, which apply to other states in Australia, not so much in Victoria. And yet some of the recommendations that came out of that review, I think, are very pertinent to Australia and some things we should be considering. And we'll talk a bit about some of those practical outcomes. But I think in short, one of them is looking at how seriously psychosocial hazards are taken in the legislation. We know that health includes psychological health from the Act, but I think the Act, the regulations could do more to make it clear that employers have duties there. Renata.
Thank you. Thanks, Dom. Okay, so
next slide.
Okay, so all of you will have done your reading this morning, your pre-conference reading, and looked at the information in there. And you will have seen this diagrammatical representation of how to deal with psychosocial hazards in the workplace. And as Dom said, it really is the framework that we follow for everything else. So the diagram that is there is very similar to the one that you've got on page 13 of your pre-reading materials. We're going to look at now how health and safety rights and powers under the OHS Act can assist you and your participation in the process. Now, tellingly, if you look at the diagram, you'll see that consultation is required throughout the whole process. The Act makes this clear, and WorkSafe material supports this position as well. Now, this is really important because we know that one of the really big issues that a lot of health and safety reps face is that the employer neglects to consult, or else the consultation happens at a stage where really it's almost too late. Or what the employer does is let people know what is happening rather than genuinely consulting. And if you have a look at the way it's diagrammatically set up, you'll see the consultation is in fact there at every stage of the process. So if we go to the next slide, please. So step one is the identification of psychosocial hazards in your workplace. So the first step, before you can really do anything, is to do something that will identify what are the issues in your workplace. And there are a number of ways that you can use that will assist you in doing this. Now, one of them is a survey of the members. This will allow you to collect immediate first-hand information. So you will find some materials in your packs, and they can also be downloaded from the website. Hand out the surveys and collect them. Note with people that they are anonymous. People don't have to say, yes, my name is Mary and I'm the one that's finding this problem. It's also important that you have casuals as well as the permanents providing, filling out the survey and giving as honest answers as they can. We have many, many workplaces nowadays where there are many casuals. In fact, I remember having workplaces when I was at a union where the only permanent person was the senior manager and everybody else there was a casual. You might find that some employers aren't very happy with reps handing out surveys to be filled out. If your employer blocks your effort to communicate with and survey your DWG, contact the union, get some help. You are their elected rep, and as elected reps you have the right, in fact dare I say the moral duty, not the legal duty, but the right to actually be able to say, well, I'm representing these people. For me to represent them, I need to know what their issues are and I need to know what's going on in the workplace. Consider too whether you're surveying just your DWG or whether you're in a larger workplace, there are other health and safety reps, they should also be doing a survey, and then you need to meet with them, go through the results, and it might be different areas in the workplace, but there could be similar issues there. So consider gathering other forms of evidence as well, and here you can access your other rights. So access to information, for example, under section 69(1)(a), checking absence and workers' comp records. Now, this is another area where you may find it difficult to get access. We have a lot of employers who say to their reps, you can't access this information, privacy. Now, the Act allows you to access information as long as it doesn't identify individuals and as long as it's not medical information. So if you have any problems with that, you need to contact the union as well. Other ways too of gathering information, meetings of your DWG, actually call people together over lunch, after work, say, look, are there issues here? Let's have a chat about it. Again, guaranteeing that you're not going to run to the boss and say, Mary Smith said this was a problem. And finally, body mapping. Now, body mapping is a way of visually representing where there might be issues. There's a lot of information on body mapping on the OHS Reps website. So these are just some ways to help you identify what the psychosocial hazards in your workplace might be. Dom.
Oh, Renata, before we go to the next slide, there was a question I think that's quite relevant to this particular issue, which is with COVID, shifts of workers have started separating. Sometimes there's a 30-minute break between shifts. And there's one HSR who asked the question about how they communicate with shifts when they're not seeing the other shift as a result of COVID.
That's really interesting.
And how they get the survey out.
Yeah, that's really interesting. I think that once things settle down a little bit, if our methods of working and the shifts arrangement at a workplace change permanently, that might be a time to start reconsidering and renegotiating DWGs.
Yeah.
You may in fact find that, remember that when DWGs are being negotiated, there are a couple of important things. One of them is that every member of a DWG needs to have access to their health and safety rep, and also that the health and safety rep is available and can get around to speaking to the members of the DWG. Now, if it means that the new arrangements are such that a rep can't see a whole bunch of people, well then maybe we need to look at either having 2 reps per DWG, which is a renegotiation, or in some circumstances maybe even having more DWGs. Now, that could trigger a whole lot of things like new elections, but they're the sorts of issues that you probably need to raise with your DWG members and also your union.
Yeah. Depending on the size of the shift as well, it might be appropriate to have had 2 HSRs right from the start.
Right, yeah.
I think there's real issues if, you know, a split of shifts means that people can't see their HSR and
Yeah.
are left without that kind of a resource.
Now, how you do the survey, we have got, you will have received pads of the survey. They are hard copies. It might be, you can also download a PDF from the website. So it might be that you save the PDF and send it round via email, and people can download that and fill it out and then drop it in a box somewhere.
Yeah.
So
speaking of the survey, next slide, please, is this is the survey that we're talking about. As Renata said, we've sent a number of HSRs hard copies. If you didn't receive one and you wanted to participate, you can download them and print them from our website. What you do, hand them all out, get them all back, add up the scores. The higher the score, the worse the problem is. Then we want you to go to our website. You're able to go to ohsreps.link/survey. There's an opportunity for you then to write how many people filled out the survey and then what the total scores were for each of these particular risk factors. The website will then have a look at your results and spit out a bit of a plan of action for you. You'll be able to look at that plan of action and work out how relevant that is to your workplace. What is there in that plan that you can take and use to implement? So certainly we're giving you the survey. We want you to come back to our website, enter the results, and then it will give you the next steps. In addition to our survey and the survey tools, there are other things, other places you can go to get resources to work out what your next steps should be. WorkSafe and SafeWork both have resources out there that sometimes can be useful. The ACTU also has a couple of programs as well. Mind Your Head is a program that they're just launching. We'll be sending out information on this through our Facebook and through email in the next week or so. So if anyone misses exactly what I'm talking about here, you'll be able to catch up. It's a new website. It's had input from Maureen and Tessa as well, who you heard from earlier on today. It's designed to improve the understanding and identification of workplace mental health and train health and safety reps and union delegates to identify hazards and manage those hazards using the same rules and tools as we use for physical health. So there's that website, which I think will be very helpful to have a look at. Additionally,
it's an easy URL. It's just mindyourhead.org.au. Quite easy.
Something else that the ACTU is putting out is an app, OHS Help. You'll be able to download that onto your phone. The ACTU has been consulting with a number of unions, and including Renata as well, in the development of this app. It has really 2 main functions. The first is a quick and easy ability to access OHS information from your phone about hazards and risks. And the second is to write up and record issues in the workplace and save photos in app as well. So that's a great tool for union health and safety reps as well. I should mention as well, in terms of taking photos, there can sometimes at some workplaces be issues about taking photos. So just be careful with that one.
If I can add a few things there, as Dom said, I was involved, but so was Dom, both before he was at the VTHC and while he's been here as well. And Dom did mention that there's quick and easy access to information. There are a whole pile of resources there. So links to other things, including to our site, guides that have been written up on specific issues like issuing cease works or how to go about getting a committee. And also a section on your rights at a glance, which goes through employer duties as well as health and safety rights. The logging an issue or a hazard is a great thing because it provides reps with an opportunity to have everything there, and they can then choose to email that once they've completed it either to their DWG or to their employer or to their union organiser. So it's a great tool that many unions hopefully will get onto, and their organisers can actually keep an eye out on what their reps are doing. Yep. So we'd encourage you to have a look at that, but you'll get more information, as Dom said.
Fantastic. Yep. In addition to those particular tools, we can recommend your unions. Your unions, not only do they have experts in health and safety, but they're very used to dealing with the type of issues that you face in your individual issues as well. They have resources ready to go. They've probably dealt with these problems before at other workplaces and have some case studies that may be useful.
And don't forget that as reps, you have the right to call for the assistance of someone in the union to come into your workplace.
Yep. In addition, Ask Renata. You didn't know I was going to do this, did you, Renata? So Simon says that that's the single best resource that he has in terms of his OH&S issues. So through the VTHC website, you can email a question directly to Renata, who endeavours to get back to you as soon as possible. Finally, before we move on, I did want to mention one other thing which I showed earlier on. This psychosocial hazards standard that we sent to everyone, or if you didn't receive it, you should be able to download it as well. On the back, under number 3, is the hierarchy of control as well. So what we're encouraging HSRs and employers to do is when they do identify a particular hazard in the workplace, the risk control that they should implement is try to eliminate, and if they can't eliminate, try to control by adapting the design, organisation and management of work, adapting the work environment, conditions or methods, or promoting supportive and respectful work relationships, I think, which is particularly important when it comes to issues such as bullying behaviour. Only if this type of intervention is not reasonably practicable would we look at information, instruction or training as an appropriate control.
You're next.
Yep. Next slide, please. Finally, once you've done your research, once you've got the result back from your surveys, it's really important before you do anything else to go back and speak to your DWG. I think the Reps of the Year mentioned this as well. You're there as a representative. So you need to make sure that what you're saying and your view on how to fix things is supported by the workers that you represent. Speak to the workers about what the survey has identified. Go with them and say, these are some of the controls that we might consider using. Every workplace is different, so decide which controls are going to work best in your workplace. Also, sometimes the workers themselves might come up with some controls that no one's thought of. Oh, this is what we should do. After all, they're the ones doing this job 38 hours or more a week. That very often they can come up with some practical solutions as well. The best controls are the ones that are implemented higher up in the hierarchy of control. We don't want to rely on resilience training to get us through these particular hazards. And the best controls are those that are embraced by the DWG as well. The ones that the DWG, the workers say, yeah, this will work for us. We think this is the best way to do it. Final thing I'll say on that as well is think about long-term controls and short-term controls as well. What can we do immediately? And what is the long-term solution for these hazards that we're dealing with?
I think that's, look, I'd like to stress that too, because too often nothing gets done because people are almost rendered incapable of taking action because it's either too hard or takes too much planning, or there's not enough money and it has to be budgeted for the next year. In the meantime, you don't just sit around and wait. There are things that can and should be done immediately, but they might only be temporary until such time as that longer term one is in fact dealt with. Okay, next slide please. All right, the next step is to meet the employer. So you've gone through with your DWG, you've developed a plan. and it's time to actually face the employer and put it to the employer. So the best case scenario will be where the employer acknowledges that there is a risk and that risk needs to be controlled. Now, it might be a matter of reminding the employer that under Section 20 of the Act, there is a duty to eliminate the risk so far as is reasonably practicable, that is, eliminate the risk. And if that's not possible, and in fact, you can't eliminate some risks, if you're dealing with very sick patients or roadside incidents where people might be injured and so on, well then it's about reducing the risk so far as is reasonably practicable. Explore the issue of what this might mean and what may be possible when you're meeting with the employer. So there are going to be circumstances where it is, I guess, part of the job, and I guess our health and safety reps this morning talking about their own experiences as midwives, there would be situations there where obviously you cannot eliminate the risk. But that doesn't mean that there aren't things that can be done along the hierarchy. Whatever is looked at, and you look at Section 21 and what the duties of the employer are, and including that there is this duty with regards to health, which is psychological health, don't forget that whatever the employer then decides to do, they have to consult. They have to consult with the health and safety reps, that is with you, on how those risks are identified. You've already taken them to them. They might say, well, let us look into it. So you'd say, well, I need to be involved in that process. And then what they plan to do about it. Now, having spoken to your designated work group, you already know or have a good idea of what controls you'd like to see implemented. Make sure that they are put to the employer. Obviously, just as your DWG may come up with things that you hadn't thought about, the employer may also come up with some controls. And the whole point of negotiation is really to meet and to discuss and to give everyone the opportunity to put those views. And you might find that what the employer puts to you is something that you can pick up. What's really important to do at this stage is make sure that you document the attempts that you've made to meet and resolve the issue with the employer. If there is a resolution, make sure that the particulars of that resolution are documented and that you let the designated work group know about it. It's very important because I've had cases where health and safety reps are really happy after they've met with the employer, and they go away and they think, that's fabulous, we reached a resolution, and then 6 months later nothing's happened. So it's very important to document it and to make sure that everyone is very clear who's going to do what in the next when. Thank you.
We'll be talking about that in a bit, but I think it always helps to follow up with an email or writing something down and showing the employer and saying, okay, have I understood correctly? This is what's come out of this discussion before taking this back, well, before going off on your merry way, making sure that there's consensus, not just written down what happened, but make sure there's consensus about what's come out of the meeting. The next slide, step 4, is debrief with your DWG. Once again, remember you're a representative, so certainly we're stressing the need to go back, speak to the people you represent. Say, we've had a meeting, this is the outcome of the meeting, either we've agreed to something and these are the next steps, what do you all think? Or we weren't able to reach an agreement, what do we want to do next? It might be appropriate this time as well to pick up the phone, speak to your union organiser or your union office. Might also be an opportunity to seek advice more broadly as well. The key thing here is make sure that when you meet with the employer, you're not there to reach agreement with the employer, you're there to try and find a solution which you then take back to your DWG. So anything that you agree on in the meeting with the employer is subject to agreement with your DWG. You need to take that back and make sure that they're okay with the controls that are being proposed. Okay, the next slide, please. Okay, step 5 is the resolution of issues. So under Section 73 of the Act, there's an ability to, if you can't reach agreement with your manager in the first instance, or sometimes it might be appropriate to jump that step, probably not, you can always request under Section 73 formal dispute resolution. This involves sitting down with a decision maker, a senior decision maker in the business, someone that's nominated to represent their interests. I don't necessarily want to get too bogged down in the details here, but the point of Section 73 is you get decision makers in the room and you get quick decisions as well. So what Section 73 says is that there might be an agreed dispute resolution procedure, and there also, if there isn't one, there's one in the regulations, a default dispute resolution procedure that you should use as well. And so that's, I think, yep, I've got it up there, Regulation 25, which says that you should be trying to meet as soon as reasonably practicable. I did want to talk briefly about agreed dispute resolution procedures, because in my time I've seen some pretty good agreed dispute resolution procedures, and I've seen some pretty bad ones. And an example of a bad one is one which says, okay, first you need to speak to your line manager, and then there's a 2-week cool-off period, and then you've got to speak to your shift manager, and if you can't resolve it, there's got to be a 2-week cooling-off period, and then you speak to the site manager, and if you don't like it, then there's a 2-week cooling-off period, and then you go to the corporate HR. You know, and by then we're, what, 8 weeks? I've lost track. 8 weeks down the pipeline, and nothing's really been agreed. The purpose of Section 73, Regulation 25, is to get matters resolved quickly, get controls happening quickly. So I think the key thing there, though, is the word, it's an agreed procedure. So I think if your procedure is one of those that implements a lot of delays...
Or, can I say one other thing? Or that tries to take away your rights as a health and safety rep, like to issue a PIN. At no point is a rep able to issue a PIN.
Oh, that's right. You see agreed procedures that say until this procedure is finalised, no one is able to issue a PIN, which is just, it has no basis under the Act. What you can do is have a look at whether or not this procedure has actually genuinely been agreed to. When was it agreed? By whom? How long ago? And 2, if it's not better than the regs, why are we continuing to agree with it? If it is worse, then that agreement should and can and should be withdrawn, and the procedure would then default to the regulations as well.
Well, the other thing also is that often these, in inverted commas, agreed procedures, no one can actually work out when they were agreed to anyway. So reps will start asking the question, or the organiser will start asking the question as to, well, when were these implemented and who agreed to them? And it turns out that they were agreed to by management with nobody else. Yeah. So in fact, they were never really agreed. So if you are faced with issue resolution procedures that the management is saying have been agreed to, and you think they look pretty, quite sus, question them and say, well, we don't agree.
Yeah, that's right. And certainly there's more information on our website about these particular issues as well. And if you are looking at your regulations, you've got a few questions about it, certainly I'd recommend reaching out and speaking to your union about it and seeking some advice about how to proceed as well. And remember that they're there to back you up if you need to have those discussions as well about whether or not something is agreed.
I might have a little plug here actually, because I'm aware that there are quite a lot of health and safety reps and maybe other people who are participating who aren't union members. And I think that this is probably a good time to say, as a health and safety rep, it is great to be a member of a union, because unions in fact do a lot of assisting and providing information and advice to health and safety reps. If you're not in a union, of course, you can send me a query, but I will probably say, oh, you're not a member of a union. You really should be, because this is the sort of thing, I'll give you the advice, but this is the sort of thing that you might need some extra assistance on. Clearly, everyone, any elected health and safety reps has the same rights under the Act, but to enable you to really stand up for those rights, sometimes you need extra backing and support. So, okay, we'll move on to the next slide, which is escalation. And it's often at this stage that reps need a bit of support, because even though it's in the law, the Act says reps have these rights, we know through personal experience and even speaking with our Health and Safety Reps of the Year earlier, that sometimes it's actually really hard for a rep to say, well, I'm going to do this, I'm going to exercise this right, and I'm going to take this further, because there is a level of concern and a level of fear. So if the meeting with the employer does not result in an acceptable outcome, or a plan to address the identified psychosocial hazards, then the HSR can, of course, take it further. Now, Section 75 says that an inspector can be required by either of the parties in Section 73 to attend a workplace to look into the matter. So you can do that. Section 60, of course, is and the following sections are about issuing a provisional improvement notice. So putting it in writing. And I had this discussion with the reps just before that they said themselves that, you know, putting a pin is actually a hard thing to do. And I made the point that it shouldn't be. It shouldn't be a hard thing to do. Reps should not feel that they can't do it. And I always compare it to when my dad used to say, I'm going to count to 3 unless you do something now. So as long as I did it by number 3, I didn't get into trouble. So a PIN is just a formal notification to the employer that you've called 1 by meeting with them. Number 2 is issuing the PIN. If they comply with that PIN, there is no number 3. No one, WorkSafe doesn't have to come out, it doesn't get recorded. It is a way of formalising that there's been no resolution to the issue raised. In certain circumstances...
Oh, before we go on, I think it's worthwhile as saying, you know, a PIN is a provisional improvement notice. It's provisional. The employer can either accept that and deal with it, or they can challenge it, and then the inspector will come out. They'll either cancel or affirm the PIN. They might choose to issue an improvement notice, which you know, is the next step. Oh well, it's the inspectors from the inspector's toolkit.
Oh, and I might add there, that's really good that you mentioned that, Dom, because when a rep issues a PIN to the employer, it's always worthwhile reminding the employer that they have these options and that they have to decide before the compliance date that the rep has put in the PIN what they're going to do. They can't just put it in a drawer and forget about it. They have to actually display it, and they have to decide, are they going to comply with it? And if they're not going to comply with what the rep wants, well, then they have to call an inspector to come in. And it is also good to remember that inspectors, when they go into a workplace to inquire into a disputed PIN, they are supposed to follow certain things. They're supposed to do it in a certain way. And there is a really good guide, How Inspectors Deal with Workplace Matters, or I can't remember the exact title, that sets out what inspectors are supposed to do, and they are supposed to make sure that they speak to the rep, and it's expected that they speak to the rep about what the issues are and do it in a way that the rep isn't at a disadvantage, and then go and find out from the employer and do a proper investigation.
I think it was really heartening hearing Colin this morning say that when an inspector goes on site, the first and last person the inspector should be talking to is the health and safety rep. Yep.
We have said so many times that, you know, if I'm an inspector and I go to Dom, who's the health and safety rep, and Dom says, well, it's A, B, C, and then I go and speak to the employer and the employer said, no, it's actually X, Y, Z, it is really up to me to go back to the rep and say, well, hang on, you said A, B, C, the employer said X, Y, Z, can you respond? Why are they saying this? So that there is natural justice, so that the inspector actually gets a really clear picture of what the real situation is. If you're not very happy, contact the union. I think that's really important too.
Something else we've had issues of is inspectors trying to have these conversations in a group with the HSR and the manager standing next to each other, and, you know, obviously say, what are you're all saying the same thing to me at the moment, and obviously, you know, there's power imbalances at play there, which creates issues.
Yep, and that's really important. Okay, so PINs are a huge issue. We've got quite a lot of information on the site about PINs. I think we even have a little quiz or a little presentation on it. So if you need advice, I know that there's a bit of training in the courses on PINs, but if you haven't issued one for a while, have a look at the website, contact your union, contact me. We can always guide you through that process. Another way of proceeding, of escalating the issue, is a cease work. Now, that is only in certain circumstances, and if you've already gone through the process of meeting with the employer and all this sort of thing, it's probably unlikely that a cease work is appropriate, because a cease work is when there's an immediate risk. Dom's looking a bit... Go on.
No, that's okay. I think sometimes, you know, cease work does require for consultation before it's issued, but I think, you know, generally people are pretty good about what that means in the situation where there's an immediate threat.
Yeah. But it is there. And it's interesting that when the Act was reviewed, it wasn't removed. I mean, it has been almost unheard of that a rep misuses this right that they have to order that work cease for a particular issue.
We've actually had quite a few, relatively speaking, quite a few cease works issued this year in Victoria around COVID and exposure to someone who's tested positive, and employers perhaps, well, the view of some HSRs, employers not taking serious enough measures to make sure that the risk is appropriately controlled.
And I think that, you know, the government has in fact responded by ensuring that workplaces have to have COVID-safe plans. And it's a good time now to remind you as reps that you have the right to be consulted when the COVID-safe plans are being developed, implemented and reviewed. So remember that.
I think one final thing on the cease works is it makes it sound like the whole site shuts down.
Yeah.
That's not necessarily the case, and that's not what a cease work is necessarily about. It might be that. I don't know, if there's a factory and there's an ammonia leak, it probably makes sense to shut the whole site. But sometimes it can be shutting down a particular area, a particular task, or a particular, I don't know, a particular work group as well.
Item of plant even.
Yeah. We're just going to issue a cease work on that particular car that doesn't have working brakes.
Yeah, which is a good example. And of course, don't forget that under section 58(1)(f), you can seek the assistance of any person who's got a knowledge of health and safety, and this would be your union organiser. Most union organisers now have REO entry permits, and to get those they have to have done some training in health and safety and demonstrated that they do have a knowledge. I guess at this stage I'd like to just a word of warning. Just remember that your role is as a representative. You don't get paid for this. You don't have specialist skills. You're not a consultant or an ergonomist. You don't have a magic wand that you can just wave and everything will be resolved. The primary responsibility of providing a safe and healthy workplace remains with the employer. And for you to really push the employer to do this, you need to be smart, you need to be prepared, you need to have the support of your DWG, and you need to have done your homework.
Fantastic. We do have a few questions that I was going to try and tackle with Renata. This is like your very own live Ask Renata session.
Oh, great.
So, one of the questions is, there's quite a few here. Will the slides also be available at the end of the day? That's one question. I think the short answer is our slides we can definitely make available. I'll need to speak to some of our presenters about whether or not they'll make their slides available. However, the intention is also to make these presentations available online. So you'll be able to...
we don't know if it'll be today.
It won't be today. But we will in the near future try and get these sessions up online.
And I guess that's a thing that you might tell other health and safety reps or other people at the workplace who maybe were not able to participate today. They'll be able to access certainly the materials and probably the presentations from that page on the website.
Yeah. Next question is, I'm not in a union. Do I join the union that is available at my workplace? I think the short answer is probably. Sometimes there are workplaces with multiple unions and it really depends upon your occupation, but certainly if there's already a union at your workplace, that's a good place to start.
And if there's a union, there's probably a delegate there, so go and check with the delegate and it should be a fairly easy process.
Yeah. How do we get the great t-shirts Renata is wearing? You have to find her and steal them. We do sell them.
Yeah, look, we did these a couple of years ago for our conference. It's probably something that we need to think about doing another run, but it is maybe not at the moment because we're all working from home due to COVID, but it is something that we'll look into. I particularly like this one because unlike some of the other ones, they don't have great big things on the back, so you can wear them in summer and you don't feel like you're expiring. But yeah, they are great. And this was the logo that we had a couple of years ago. It was a bit of a Batman logo, but it was really great. So we'll look at doing some more merch.
Okay, another question. The link for the survey is ohsreps.link/survey, but if anyone misses that, we will be putting that up on our website as well. So you'll be able to find that, click through and find that pretty easily on our website. Renata, should we provide our company with a copy of the survey before we hand it around to employees?
Look, that's something that I think I would say it's horses for courses. I believe that the better relationship a health and safety rep can develop with their employers, the better the outcomes will be, because you really are there to be representing your fellow workers, to try and make that workplace healthier and safer, to try to get the employer to make that workplace healthier and safer. And there have been several studies that have shown that places with health and safety reps are healthier and safer workplaces. But because it lies with the employer, if you've got an employer who's cooperative, who is genuinely committed, you're going to get a better outcome. So you don't want the employer necessarily thinking, oh, they're doing this behind my back. So after today, it might be worthwhile going in and saying, can I have you know that I've just been at a conference, could we have a chat? And make an appointment, go in and say, look, you may be aware of it, you may not be aware of it, but the number of workers who put in work cover claims for psychological injury is growing in Victoria. And it's not just an issue that affects nurses or doctors or policemen, it can affect anyone. And so what I'm trying to do is try to see, do we have a problem in our workplace? Do we have any risk factors in our workplace? And as the rep, what I intend to do is talk to the DWG and do a survey and be able to represent the workers. So then say to the employer, would you like to have a look at the survey? It's something that's been provided by the Trades Hall. As long as the employer doesn't say, well, you can't do it.
I think that's right. The conversation should be about how am I going to get this done, not whether or not I'm allowed to do it. I think, asking for permission when you've got the power under the Act to do something is a fraught kind of a question.
It's not about asking permission.
In the same way that you've got a right to conduct inspections, the conversation with the employer is when can I have a reasonable time to go around and conduct an inspection. It's not can I please do it, or when you're not asking them permission whether or not you can do it, you're asking them how we're going to get this thing done.
Yeah, you might say, look, I'd like to facilitate this. How can you facilitate this for me? And it might be, running off copies, or it might be sending an email to all the people there, whatever. So it is a matter of ensuring as much cooperation as possible, because at the end of the day, you're going to be going back to them and saying, hey, look what this is identified. We need to sit down and talk about what we're going to do about it, what you're going to do about it.
Ooh. My DWG has 1,200 people. That's a very big DWG. And one DWG is it acceptable to use an anonymous Google survey? So I'm assuming the question is whether or not you can turn this into an anonymous Google survey. I see no reason why that couldn't be done.
Yes, but 1,200. Look, this is really interesting because often DWGs were set up God knows how long ago. And I'll go back to what I mentioned earlier. And the thing about setting up DWGs is that the DWGs have to be done in a way that best and most conveniently enables the interests of the employees in relation to health and safety to be represented and safeguarded, and best takes account of the need for a health and safety rep for the DWG to be accessible to each member of the group. Now, if you've got 1,200 people in your DWG, those two conditions are not being met. It is impossible, I believe, for one person to represent 1,200 people, or for 1,200 people to have access to one person.
Even if you had half a dozen HSRs as a result of that one DWG, there'd probably be a diverse range of what's going on.
So, look, you really need to be looking at section 44, 43, 44, 45, 45 is if you can't get agreement of the Act, to be saying the 1,200 need to be divided. I would divide them. It could be different shifts. It could be different areas in the workplace. It could be different jobs that they do. If it's not possible to divide them, well, then you'd be looking at more than one more than one elected rep. you might have, more than 6. I don't know. I mean, there are workplaces where things like shifts move around and people move around, and you can't necessarily make them 6 DWGs or 12 DWGs or whatever, because even 100 people to me is too many in a DWG. Okay. But you need to look at that. Okay. And yeah, that's what I'd be doing.
There's a couple of questions which, although different in subject matter, have the same answer. So I'm going to ask them both, which is, as HSRs, is it much of an issue to use your phone to take photos for evidence if there is an incident? And the other one is, what about in the instance that the HSR is not on site when the inspector arrives?
Okay. I don't think they're the same answer.
I do.
Okay, you answer it and then I'll add.
Okay, fair enough. Look, I think when an inspector arrives on site, they should be putting out an inspection report, which should be going to the employer and to the HSR. So I think it's a matter of having perhaps good processes through an OHS committee, perhaps agreeing that when an inspector comes out on site, all HSRs who have workers or members of their DWG who work in those areas, the inspector visits, should be forwarded by the employer a copy of the entry report as soon as possible.
I disagree.
Do you?
I think there's a step before that. Inspectors, when inspectors go to a workplace, they are, under the Act, required to notify any health and safety reps. No. So if the health and safety rep in particular isn't there, say if they've come out to look at a pin, that inspector they should have actually organised to see that health and safety rep before they went.
If it's not for a pin though?
If it's not for a pin, they still need to notify all the reps that are on site.
Yes, but what happens if,
if there's no one there?
You're on afternoon shift and the reps come, they've spoken to the morning shift rep of the exact area?
Well then yes, then I agree with you. Then they need to get a copy of the report, but also give the rep the opportunity, if the rep feels that because they weren't there, they weren't able to show the inspector something or to give some information, that inspector should be prepared to then also come back and take more information from that health and safety rep.
Yep. The other question, which was in relation to photos as well, is I think I stressed some workplaces it's fine to take out your phone and snap away. We shouldn't forget the Act was written in 2004. iPhones came out in 2007. When the Act was written, not everyone was walking around with a camera in their pocket. There are some workplaces where they might have proprietary information or processes which they treat as confidential. Mm-hmm. So it might be a breach of your employment contract to pull out your phone and start snapping away. I think a good way to resolve that is to have that, once again, that discussion with the managers, maybe in an OHS committee, and get an agreement of when mobile phones, it's appropriate to use mobile phones, and then everyone's on the same page.
Yep. And we have to keep in mind too that there are many workplaces where workers can't have their mobile phones with them, and so there are a number of issues surrounding the use of phones to take photos that need to be discussed. Yep.
Certainly I know that some companies will say no phones allowed, but an HSR has access to a camera that's locked in the office and they've got a key, and if they see an issue, they can go and use that camera as well. That's an option. And certainly sometimes when you say, let's go buy a camera and keep it in a locked thing, they'll say, no, just use your phone.
Good alternative.
Let's have a look. My employer doesn't understand the role of an HSR. Do you offer training to employers? Trades Hall does offer training to employers, and they should check our website, and we run the course several times a year.
Yeah, and I think that's a really important thing that, this is my little Bible, and no doubt it becomes your Bible as well. And for those who don't have one, we also have an annotated version that we're quite proud of. We're maybe doing a reprint because there's been a couple of changes to the Act. But even though the employer is the one that has the duty to comply with legislation, I sometimes am shocked that employers have no idea what's in this, and they have no idea of the regs either. So this is why, in my view, the role of the rep is to be the finger that pokes the employer in the arm to say, did you know that this is what your duties are? Did you know that I have these rights? Did you know that under the whatever regulations you have to do A, B and C? A lot of employers don't take health and safety very seriously. Sometimes I think it's because they haven't had any major incidents. When someone has an incident at the workplace, oh my God, then we read this often when the prosecutions occur. The employer goes around and spends a lot of money to fix things up and introduce things. And had they only done it before, that injury, that fatality would have been prevented. So don't assume that your employer knows. Unfortunately, part of your role might be to educate or to push them to do our course.
Fantastic. Is stress and having time off, is it covered under as sick leave or work cover? So
Okay, so it all depends on the cause.
Yeah. If you can establish it's work related, then yes, you need to make a work cover claim. And if you have, obviously, when you make a work cover claim, before it's approved, you are on sick leave or annual leave. And if your claim is approved, then that leave is reimbursed.
This is where it's very, very important to make sure you have a regular doctor that you see. Because if you don't go to the doctor, to put in a work cover claim, you have to have a certificate, and your doctor has to actually put on the certificate that this is a work cover claim, that your condition has been caused by or exacerbated by something at work, by your work. And I think that, as we heard this morning, the number of claims and the seriousness of claims around psychological health are increasing. And it's terrible because by the time a claim is accepted, it's often very serious. This is why it comes back to us as health and safety reps, us as unions, identifying the risks so that we minimise the injury to workers.
Yep. We do have, we'll see how we go.
We've got 5 minutes.
5 minutes. One of the biggest stresses leading to psych injuries in schools is our workload. Unfortunately, schools are given a set budget by government, which isn't necessarily enough to do everything that's expected of us. Any tips on controls that we could use to address the issue of excessive workload? Well, I'll say that this perhaps is not something that's
I was a teacher for 10 years too. It's not just teaching.
It's not just teachers, right. This kind of workload issue, but certainly this kind of idea that there's a budget and you just have to work with it.
Yeah, I think that what has to happen, we all know that there are budgets everywhere, but what needs to happen is once there is a recognition by the people who are managing, so the school principal and whatever, if there is enough evidence there to say this is such a huge issue that this is affecting our health and safety, then something needs to be done. Now, what can be done will depend on the situation, and I'm sure that the health and safety officers, organisers at the unions will have some ideas, but just accepting that our workload is such that there is nothing we can do about it is not right, because there is always something that can be done. And I have to say, after my 10 years of teaching, which was a long time ago, I would get to the end of the year with a pile of unmarked things this high, and quite often this was my control bin. Not that I recommend that for during the year.
Probably good that you're no longer teaching them, Renata.
Probably is.
Okay, no, we do have, we'll go with one more question, which is, Renata is saying regarding the OHS support, I'm a safety officer and we don't have any elected HSRs or DWGs. What should I be doing with the survey if I'm an appointed HSR? So the first thing I say is this conference is obviously the Health and Safety Rep Conference, so that's our audience and that's who we're talking to in this instance. I'd say if you're a health and safety officer, the duties under the Act on you are to provide a safe workplace. So,
or for your employer to provide it.
Well, for the employer and the manager so far as well. Surveying your employers is something we encourage HSRs to do, but I think it's also a good idea for employers to be doing that as well.
If you don't have health and safety reps or designated work groups, there's nothing in the Act that actually says that an employer can't initiate that process starting. Now, normally in workplaces with health and safety reps and DWGs, that's been initiated by union members because it's one of those circular things. If you don't know you have the right to a rep, how do you actually get a rep? So in a workplace like yours, what you can be doing is in fact raising the whole thing of what workers' rights are under the Act and saying to the workers, we are committed to health and safety. The Act gives you as workers the right to participate. The way to participate the best way would be for you guys to actually have elected reps. And we want to start talking about the processes to start having designated work groups and elected reps in this workplace. If there are any union people there, I'd be talking to them as well.
Fantastic. Say as well that a number of unions offer training, and Trades Hall also offers training as well. If your individual union doesn't offer OH&S training, we cover that.
And getting back to the safety officer, under Section 35, it is the duty of employers to consult their employees. Where there are reps, it has to be with reps. Where there are no reps, you still have to consult with employees. So yes, if you're looking at, are there risks to psychological health in your workplace, you need to be consulting with your employees.
Fantastic. Look, I'd like to take this opportunity now. We're going to wrap it up, but before I do, I want to just give people a heads up on what's happening afterwards. Can we go to the slide, the last slide? There we go, union caucuses. There are breakout sessions for HSRs and deputy HSRs only. So thank you everyone else who's participating today. We hope that you got something out of this conference. The next breakout sessions, as I said, are for the HSRs and deputies.
Union and non-union.
Union and non-union. HSRs and deputies, first thing we want you to do is have a stretch and grab a drink. At, what's the time? 1:45, the breakout sessions will commence. The website on the slide should take you to a list of breakout rooms, and they're divided up by unions. Those reps who are not in a union, there are 3 sessions. We've decided to separate those sessions out based on the first letter of your surname, simply because to control the group sizes as well. It just seemed like the best way to do it. That's also the case for the United Workers Union as well. They have 2 sessions. You'll see that those differentiated. Some unions are running their own sessions and other unions are grouped together. This was once again just based on numbers. Finally, I do want to say that you should receive an email shortly. This email will be a certificate for the conference for the day. We also encourage you, there should be a link in that email to provide some feedback on this conference. It's a new thing for us, running a conference like this online, so we'd be really interested in what you have to say, and we'd encourage you to fill that in as soon as you get the link as well. Fantastic. Thank you very much.
Thank you, and good luck, and thanks for listening to us.